These are my audience. Hi everyone. As all of you already know, I'm currently majoring in radiologic science here in Holy Family. So I thought it would be awesome to introduce and explain to you all the many different modalities that is considered to be part of radiology that you may not be familiar with. So what is radiology? Radiology usually involves the visualization of anatomical structures such as bones, organs, and lungs onto an image for diagnostic of pathology. On top of that, other forms of radiologic modalities allow for detection of cancerous tumors, anatomical perforations, and also cancer treatments. The more common modality under radiology that a lot of you may know and be familiar with is general X-ray. X-ray uses radiation that penetrates the body to allow us to see dislocations and abnormalities. This is what we usually get if we experience a fracture or if we need to rule out respiratory infections. X-ray can detect pathology within the body, blockages, and dislocations. X-ray is what I do every day. I go into clinical at my assigned hospital. I brought in some anatomical markers to show you guys. These markers allow the doctors to see which side of the body is which. Surprisingly, it is kind of difficult to look at an image. If you haven't marked it, you wouldn't really be able to know if it's the patient right or left side. So this is what the markers look like. This is the right one, as you can see. It has my initials, so you know which tech did the examination. Now, moving on to different modalities that's under radiology. Another common modality, which is a much faster, more detailed modality, similar to X-ray, but it's called CT or CAT scan. Now, CAT scans are special because it allows for images of the anatomy in slices, which allows it to be reconstructed in the computer and allows the image or the body part to be viewed in three-dimensional view. It is also much faster to perform and great for emergency traumas. Another modality that is unique because it does not use any radiation is MRI. MRI uses strong magnetic fields, radio fields, and a computer to image the body. Now, MRI is a good examination for someone who does not want to be radiated, or maybe someone who has to have a lot of exams that has or consists of radiation. But the downfall of MRI is that it is a very long examination and it can take up to an hour. Another modality that does not use radiation is ultrasound. Ultrasound uses sound waves to image the body. This is what the doctor would use if they would want to find out a gender of a baby. However, you can also use ultrasound to detect abnormalities in the veins, arteries, and heart. Now, the last modality I would like to talk about is radiation therapy. Now, radiation therapy is a little bit different because it does not involve imaging a body part. Radiation therapy uses an intense beam to kill malignant cancer cells, which I think is pretty cool. Radiology itself is very fascinating to me. There's a big range of different modalities that's considered radiology that is unique in its own way, that helps to detect pathology, diseases, and can be used as a treatment for diseases and cancers, for example, radiation therapy. I think radiology is very crucial in the medical field. I think it is much needed, and I think it is life-changing as well. I hope you all were able to learn about the many different types of radiology modalities from my speech, and I hope you guys enjoy my speech as well. Thank you.